Are you waiting for your fairy godmother to make you slim and trim with the wave of her magic wand? Are you ready to stop wishing and start getting results? My name is Sue Condon. In this, part 1 of a 3-part series, I'll be discussing how your weight impacts your health. In part 2, you'll learn why diets have not worked for most people and the science behind it. In part 3, I'll be sharing Transitions Lifestyle System, a program that was developed by a team of doctors, nutritionists, and fitness specialists, with clinically proven success helping people get healthy and lose body fat for good. And there's no magic wand required. So what exactly is good health? According to Webster, people in good health have no diagnosable disease or symptoms of disease. Problem is, by the time symptoms are present, it just might be too late. After all, the day before you have a heart attack, are you in good health? We all know Americans as a whole are getting heavier. It's in the news. Possibly the fact that the problem is so widespread is fueling the epidemic. You know the old saying, misery loves company. We're allowing ourselves to be conditioned to think being overweight is okay. How would we determine our proper healthy weight? One way is using the proportion of body fat to lean mass. According to the American Council on Exercise, acceptable for men is 18 to 25% and for women is 25 to 31%. Do you know your body fat percentage? Most of us don't. But we do know our waist measurement. And acceptable for men is 38 or less inches, and for women is 32 or less inches. Remember, that's acceptable, not necessarily optimal from a health viewpoint. What's fat got to do with it anyway? In 1962, research statistics showed that the percentage of obesity in America's population was 13%. But by 1980 it had risen to 15%, in 1994 to 23%, and by the year 2000 the rate had reached an unprecedented 31%. The federal health surveys during that same time period showed the average waist size had increased for men from 35 to 39 inches and for women from 30 to 37 inches. And that excess fat around the waist has been linked to a greater risk of many health problems, including heart disease, diabetes, stroke, hypertension, breathing problems, disabilities, cancer, and higher mortality rates. The U.S. Surgeon General reports obesity is responsible for over 300,000 deaths per year. But the most alarming statistic concerns obesity in children. Research shows that childhood obesity has more than tripled in just the past 2 decades. And because adolescents that are overweight have more than a 70% chance of being overweight adults, this is the first generation whose estimated life expectancy is lower than their parents. The American Diabetes Association, the ADA, estimates 21 million Americans have diabetes and 54 million have prediabetes, which I will be explaining a little later. But 9 out of 10 cases are type 2, and what's important is that type 2 diabetes is environmental, which means it's totally preventable. And that's the silver lining. The ADA finds that reducing your weight by 10%, you can significantly reduce your risk of disease. In addition, you improve mobility, energy, and stamina. You get out of that mental fog, and obviously improve appearance and self-esteem. I know what you're thinking. If you're listening to this, you obviously have been trying to get rid of that excess fat. I also may know why you're frustrated. There are 5 factors that cause people to become metabolically challenged and make it difficult to lose weight. Yo-yo dieting. Losing and gaining as little as 10 pounds can slow your metabolism. Crash dieting. Dramatically reducing calories. You know, there was that special event that you starved yourself to fit into that dress. Sedentary lifestyle. We all spend way too much time in front of a computer or a TV screen. Garbage in. Just eating the wrong kind of foods. And who doesn't have stress? Are you married? Do you have kids, a job? Or do you commute? You know, when our ancestors had stress, it was a physical stress, which required a fight or flight response. They would come across a bear, let's say. They would need energy to escape. The brain, whose primary focus is survival, would send out a signal for the body to release the hormone cortisol that would help produce the energy to run and get out of danger. But now our stress is emotional, and our brain is still pumping out the cortisol and producing energy. And when we don't use it up, that additional energy is converted to fat and stored around our midsection. But the good news is there is a solution. Now that you've started on your path to understanding how to crack the diet code, don't stop now. In Part 2, we compare popular and commercial diets, and in Part 3, we discuss science-based solutions that can get you into those skinny jeans the healthy way. See you there.